At Desert Oasis Healthcare, we're committed to keeping the community informed and safe. Welcome, everybody, to Studio DOHC. My name is Lindsey Valenzuela, and today I'm here with an exciting group of people to talk about MPox. I'm going to have them introduce themselves. To my right.
Hi, good morning. Brett Klein, and I'm a community activist, educator, HIV positive for 35 years, and so working every angle to keep our community safe.
My name is John Kirby. I've been a public health advocate since I got sober about 30 years ago, working at the crux of HIV, sexually transmitted infections, homelessness, mental illness, and substance abuse.
My name is Renee Hebert. I'm the current International Mr. Leather. I have been involved in community and activity work since I was about 22, so almost 20 years.
Hi, my name is Dr. Jae Young Lee. I'm a infectious disease specialist and primary care at Desert Oasis.
Hi, I'm John Taylor, and I'm not a doctor, but I'm the morning host on KGAY 106.5 and 92.1, the pride of the Valley, and we are definitely involved in doing what we can to keep people safe and to inform them about MPox.
What is MPox and how is it transmitted? Maybe Dr. Lee, you can take us through that.
MPox has been around for longer than we think. It was reported in 1970s in certain part of Africa, but it's been kind of neglected for a long time. As you remember, 2022, there was a international public emergency when that spread outside endemic area in Africa. And then it kind of calmed down later. This year, we have new clade is popping up.
Since that public health emergency you mentioned in 2022, we've had 389 cases in Riverside County. And a good portion of those have occurred in the desert area. 2025 is seeing a surge of cases right now, with 24 having been reported officially since September. And one of those is a clade 1, which of course is more severe. Historically, when you see it in other countries, it has a higher mortality and morbidity rate, meaning people just don't do as well with clade 1. How is it spread, and how are we thinking about spread here in Palm Springs and the Coachella Valley?
It occurs basically skin-to-skin contact. Obviously, the highest risk is sexual contact, but it can be transmitted by simply hugging and kissing and any kind of bodily contact, household contact, especially in some communities such as MSM.
Tell them what MSM means. They're using the medical terms.
Oh yeah, I did not realize this. Men having sex with a man is MSM. It doesn't have to be gay or straight or bisexual, but anybody who has sex with a man is considered as a risk for MPox. It can be also transmitted by inhalation and the respiratory tract, but it's much less likely occur than skin-to-skin contact.
What about the gym?
Yeah, gym is so if you have MPox, most people have some skin lesions. Once it's healed and crossed, it's much less likely it's transmitted. But if you have any kind of skin lesion that makes us suspicious for MPox, that's when you have a highest risk of transmission. Obviously, we don't always check our whole body in daily basis, but if you can, try to wear the glove, try to wear some more skin protection would be always helpful.
We're talking about this, some people are thinking of this as a sexually transmitted infection. But of course, from what I'm hearing from you now, it sounds like while that may be where we got it into the community and how it originally showed up in the community, as we're talking about community spread that's happening right now, what community spread mean is essentially that people don't have to leave and travel outside of the country or the area to get it. You can get it being locally. So what does that mean for the day-to-day for people who might be impacted?
Well, I think it's important to also note that prior to those lesions showing up, the virus can shed from the skin for 4 or 5 days prior to that. So you won't see any lesions or rashes, and you could still transmit the infection or get the infection. With as sex positive as the community is out here in the desert, And we have various venues where we can go play on the weekends, and the gym and the crowded bars and rubbing up against each other during disco nights or whatever the big parties are that are happening that week, because there's one every week in the desert. You don't even have to be having sex in order to get this. When we go out to the sex venues or we go out to the resorts to play, that we're paying attention to whether or not stuff is being cleaned off before we start playing on it.
Absolutely. So we really need to get to a point where we can share this information, this particular piece of information, with the LGBTQ, the MSM community. Now we know what that means, to make sure they're aware about techniques to mitigate risk or to reduce your risk. Now, John, you're the voice of the desert. You have a real pulse on the desert. Do you feel like our current means of sharing information, communication from the radio, internet, different areas like DOHC, is really getting to the community in need?
Well, I think the first go around in 22, we were lucky that we had a really great guy who went overseas. He contracted MPox. He was our first diagnosed case, and he went public. He wasn't ashamed. Evan Goldfarb, I want to say his name and thank him, because I think he made it real to people. Oh, I know him. That could happen to me. And also we have a really good, community of health providers with Desert Oasis Healthcare. We've got our Riverside University Health Service with Jen Chavinsky leading the way. We had a task force of stakeholders in both medicine and the community that was, getting the word out and trying to find vaccine for people. And I think that as long as we're talking about it in a way that isn't, shameful or isn't like under your breath, and be, able to have that conversation, that's how you get the word out, and use all of those outlets, whether it be social media, whether it be the TV, the radio.
So you mentioned something there about, really trying not to alienate people while getting this communication where it needs to go. Are we doing a good job of that? And how these sorts of conversations, how can we reframe the conversation to make it more accessible for people to listen?
Well, we do. I think we are. Palm Springs, I would say the Coachella Valley is doing what we want it to be doing in many, many, many ways. Between the radio stations, the healthcare Desert Oasis, all of our other medical partners in the community have focused on it and made it a clear message. The key part is that we have so many visitors from so many places. Literally the last 3 weeks, International Gay and Lesbian Tour Association, we had 32 countries here in town. Wow. And we had Leather, Pride, which we had multiple people from all over the country. And so, our medical community rose up to make sure that whether it just be MPox, HIV, STIs, Hep C, there were testing, there were things, there were messaging, because when these people leave our community, they go back to, in many cases, their silo and their hidden agenda, they're not agenda, their hidden lifestyle in many ways. They don't have a provider like Dr. Lee and others who are openly going to be able to answer any question at any time that you had ever had, and all the providers in our community usually do that. But they're going to go back to these places. And so we have to, like KGAY, not only when they broadcast, and they have listeners from all over the world, when we travel, we are always tuning in and listening, and but you tag the other ones. You have to think of where these others are, and maybe you met someone at a community center from Louisiana, which I did this weekend. Well, now they're going to be tagging KGAY and Desert Oasis because, we had some knowledge that they didn't know about.
No such thing as TMI.
Yes.
No,
Yeah.
and it's so interesting because we're all members of this community of Palm Springs, and I think we take it for granted how open our conversations are on a daily basis, whether we're within the LGBTQ community or not. Right. Those are all very open conversations. So I imagine you talked a lot about PrEP and how PrEP only covers certain risks, right? Did that come up during the conversation?
Yeah, I think people, they know enough because they've seen enough for their own health and well-being. Hopefully they've paid attention. but they still don't know enough. They don't really think out of the box. Oh, I had prep. I have this, and I have my DOHC after the weekend. Well, how much did you play this weekend? Well, I played for the last 7 days. Well, how often did you take DOHC? I asked someone last night, and he goes, oh, day one. Well, guess what? You've seriously missed the window here. You've had 14 different partners over the last 7 days and nothing, and that's just a lifestyle, whether that, it's not all just about LGBT. There's many in our swinger community that is hidden behind the scenes, that does not want to be known, that are at risk as well. I think Renee is going to be a key point when, unfortunately, when you transfer back to Montreal. He is our voice to be able to carry not only Palm Springs, but to carry PLSLOD and the leather piece. And he's got an international stage for the next year, well, always will have, to bring this message forward.
So, before I moved to the desert, I lived in a much more conservative city. I lived in Edmonton, Alberta. But I remember the shift from moving to Alberta to here with regards to just sexual health and the attitudes towards sexual health in general, even from healthcare professionals. When PrEP first started being prevalent and started being a thing, I remember talking to my general practitioner, and she went, well, why would you want that? Just use condoms, it's fine. Condoms, like she practically shouted it at me. The comfort around who I am and who I'm intimate with has shifted just based on that lack of stigma. And I think that promoting this just blunt, direct, hey, this is the reality of it, there's no shame. Like, let's get you tested, let's get you coverage, right? Because that's how we protect all of us. We protect the individual, and that protects the community.
Well, it turns it from one thing into healthcare. Right. And we all experience healthcare for many different areas of our lives, and this is just one part of that. And if you can bring it back to the clinical necessity of everybody's healthcare, I think it goes a long way. Right. Now, Dr. Lee, maybe you can talk to us a little bit and just make sure that our listeners are educated on what PrEP covers, what DOHC covers, and is that MPox? Is MPox covered by that?
No.
I know.
Absolutely not.
The big NO.
Yeah. No. So, the DOHC PrEP cover chlamydia and syphilis, some degree gonorrhea, but technically no. As far as we know, the only way to prevent MPox is the vaccination. When 2022, a lot of people, I believe, they got vaccination, two shot on your forearm, subcutaneous, 1 month apart. It's still very highly effective, close to 80% effective. It gives you immunity at least for 5 years. So if you got 2 shots in 2022, you are good for now. And other than that, none of those medication, doxycycline or Truvada, Descovy, can prevent you from getting MPox.
And just to follow up on that, Doc, I've had several folks on my social media, because I push this MPox education out across like 30 groups out here in the desert. And folks are saying, oh, my doctor gave me a 3rd shot, whether you think that's horse hockey or not. Can you talk about 2 shots is enough? You don't need a 3rd one because it's not going to do any more than the first 2 did?
It's a virus, so it's working with the antibody and the cell immunity, but we at least know the antibody can be lingering at least more than 5 years. So theoretically, there's no benefit of getting a 3rd shot. And we're also living in the world that we have a limited resource. So now we don't have that much government funding for vaccination. So getting an additional shot not only is not necessary, but you take away the chance of other people who really need a 1st and 2nd shot.
Yeah, I think that's important. And if people wanted to look more at the details of vaccines and maybe read some more about the MPox vaccine, Jynneos, I know that CDPH has a number of resources. RUHS has a really amazing site that I'm sure will pop up here on the screen that can not only give you the data on what we're seeing on a regular basis and track it over time, but also give you information on who should receive the vaccine. Really, anybody who attests to being at risk should receive 2 doses of this vaccine. And if you have not received the second, even if the first was given years ago, go in and get the second. Complete that series.
And if you're on Facebook and you have questions after you see this podcast, you can look me up, John Kirby. That's Kirby.
Thank you. I really think that you're an amazing resource as a group for all of this information. I saw lots of pictures from pre-Pride and Pride with meetings happening, all sorts of different parts of our community. You mentioned people like swingers who are coming from other areas who don't necessarily get to live that life as authentically as maybe we get to live here. So did you see a lot of variety of people at those meetings really taking advantage of this education?
Yes, I mean, we were staging a lot of different lectures, thanks to you with John and others. Polyamory, harm reduction in our community and a multitude of levels, panel discussion with providers and LCSWs and others in the behavioral health side. And one of the biggest things that came up through no matter which topic it was, is the idea as we're an older community in many ways, myself included. And so you think, oh, I'm protected. Oh, I'm fine. Oh, I didn't have sex. But like I saw you making out with 42 different people in the bar, and it says, potentially respiratory spread. Yes, that's a minimal possible for MPox, that people just don't equate that and they think, oh, I'm fine. And we heard a lot of that. And then we had all of a sudden people who was like, oh, maybe I'm not. And they were taking serious notes and asking them questions. And we're more visible. And thankfully for PSLOD, and this will be an ongoing piece, it wasn't just Pride. It'll be quarterly lectures. There'll be other things they're partnering with our medical community, not just one, but multitudes. HIV and AIDS research project, others locally for a multitude of areas to kind of bridge that gap. And hopefully to have people, if they have a subculture and a community of whatever that may look like, that they would invite those providers in for the private cone of silence type lecture.
We talked a lot about people coming into town and then leaving town, or have big events that happen throughout the year, but there's the after. And if somebody should be concerned at this point that they might have contracted MPox, what is the next step?
The initial symptoms of MPox mirror the symptoms of COVID or the flu. So if you start feeling like you're coming down with a cold or the flu or whatever, do a COVID test if you've still got one in your bathroom. And if that's negative, talk to your doctor. Don't just trust that it might be the flu. Get to urgent care and tell them. There is some medication called TPOX.
Yeah, TPox has been around mainly for smallpox in the past, but it has been used for MPox as well. And since 2022, there's some study done for TPox. One was called the STOMP studies, mainly for clade 2, and other study was done recently in Africa was for the clade 1, which we are more worried about these days. Unfortunately, the TPox didn't show that much efficacy in terms of shortening the duration or severity of the symptoms. It helped, but not statistically significant based on those two tests. But still help if you get it early enough. Also, if you really immunocompromised with the HIV, with the CD4 count less than 200, or other strong immunosuppressive treatment for organ transplant people, those people are really get more bang for the buck from the TPox, especially if you get it early enough. Other thing is, even if you didn't get vaccination, once you get symptom of MPox, you can still get post-exposure vaccination. It's more effective if you get it within 4 days after you get infection. But you can go all the way to within 2 weeks, still beneficial.
Let's say I've already completed my 2-dose series, and I, come in and I've got the beginnings of MPox. Can I still get that vaccination?
If you have already got 2 shots, there's no role for getting another shot for as post-exposure vaccination. There's some theory you can get immunoglobulin if you really immunocompromised, but there's no role for additional vaccination. But if you haven't got total 2-shot, you should get the post-exposure vaccination, ideally within 4 days.
So we have the advantage in this country of having more supportive care, but of course we know that a lot of that depends on people's access to health care. What have you seen out in the community that has been done to support those people who might not have access to health care that they can afford?
Riverside University Health Service was out with Jynneos vaccine at PSLOD parties and giving people Jynneos. And I think Riverside University Health Service does a pretty good job of kind of filling that gap in the community. And they do have centers where you can actually come in. I don't know if they all have Jynneos, but you can talk to somebody.
And I know that I've seen on their site actually a place where you can go and look for vaccine clinics and identify the dates and the times where you can go in and be vaccinated. Calendar changes on a regular basis, so going on there and seeing what's available near you for vaccination.
And then another thing to consider too is the undocumented community and what's going on with Medi-Cal right now and what's going on with ICE. And folks that, if you're undocumented and you sign up for Medi-Cal before December 31st, you will get full scope Medi-Cal and just renew it every 6 months. If you don't, or you're too scared to do that, you can still get free treatment at any federally qualified health center, of which there are 3 that I'm aware of in the Valley: St. John's Community Health, DAP Health, and SAC Health. And I think there's a couple more whose names are escaping me right now.
So I would really also implore, like, if you're an employer that one of your employees is saying, hey, I need to go get tested, I need to go get vaccinated, whatever, have the support system for that. Because a lot of the time, it's not that people don't want to get checked and don't want to go get vaccinated, is that they literally can't because of their work schedule or because of other commitments. So I think that support system needs to really be there as well.
Are people who, like, we're in the tourism business, is one of our largest industries aside from medical. But the people that are the lowest income on the food chain in hospitality are dealing with towels, sheets, and they're at risk too.
Absolutely. They're cleaning the beds. They're taking that off. I was not aware and thinking, you're at someone's home, you're doing whatever, you're having fun, whatever that looks like, or you're staying at an Airbnb and, hey, you crash here for the night because maybe you've had too much to drink, whatever. But those bed sheets, those things, it's those transmission areas that never crossed my mind.
Absolutely. And I think that's why, as we've been talking about today, this message needs to hit every part of the Coachella Valley, regardless of sexual practices, sexual orientation, income, job status, immigration status. Everybody needs to know this information.
It is, and it's like when it's saying it's funny, many people have gone off some of the platforms for a multitude of different reasons. However, if you are going to be on those platforms and you're tired of all the crap we get every day and all the stuff because of the algorithms and all that, take monkeypox, take MPox, take whatever vaccination, take Riverside County, take DOHC, whatever, and just make that your post every day throughout, because it'll just be like, bombard the system with health as opposed to all the negativism that we're always putting out there, because that's what's coming to us, and then we immediately want to respond. It doesn't do us any good, but the healthcare message, that's what I'm trying to tell people. It's like, then just focus on healthcare.
And one of the things that medical professionals with initials behind their names can help us with in the social media sphere is, as you're scrolling and you see stuff about MPox that's posted in some of these groups, and you see some of the disinformation that's getting thrown in main posts or in comments or whatever, if you could help us and say, hey, I'm a doctor and here's what's really true, that would be terrific, because I don't have initials after my name. I just read too much.
And though that message does change when it's coming from somebody who is a clinician or licensed. I guess, one of the questions I have is, what are the 3 main things that each of you thinks is particularly important to this subject, to MPox?
Let's talk about it openly. So, conversation, information, credible, with footnotes, with research from people with initials behind their names, and also engaging with people that might have misinformation. And you don't have to shame them. You can just say, oh, that's interesting. I read that Clade 1 is more dangerous than Clade 2, and that it was a local transmission, and so it's endemic. It's not people that traveled outside.
look around your neighbor, look around your friend, you look around your anybody you can think of, and make sure they are in the good hands. They are well informed. They help each other.
Communication without stigma is a huge one. The more that we talk about this without shame, and the more normalized the communication around health is, I think the more likely people are to actually take appropriate steps. The second is, like we've talked a lot about this being an older community. That is starting to shift as you have more tourists year round, as you have more people coming in from LA and San Diego. And we have some people who are active who have never been active without PrEP being part of the equation. So I definitely would encourage people who are like 30 and under to take this seriously. We have people who have lived through the really bad days of HIV that are like, oh no, not this again. We're going to do this now. Well, the younger generation doesn't have that trauma response. So yeah, just please take that seriously. And the third one, just wipe down your gym equipment before and after use. Seriously, it's just I try to go to the gym regularly, and the number of people that actually do that is staggeringly low.
First of all, you can get it too, even if you're not getting laid. 2, vaccines work. They don't cause autism. And 3rd, there's an answer out there for you somewhere. Call me and find it, or call someone else and find it. Don't give up until you find it.
Ask, educate, share. You know, for me, it's like if you ask the question and you got some type of answer, and maybe you've been a little more educated about what that might mean for yourself or a family member or your LGBT son or daughter or any combination, then it's like share the information, share a website, share the things we've talked about.
I think Desert Oasis Healthcare and many of the other organizations in the desert really feel it's our responsibility to lead on good quality healthcare education. But I appreciate your roles in the community of really taking that person to person and making sure nobody goes missed with that education. But we need to continue the conversation. Make sure that this isn't a discussion that happens only around Pride weekend, that this really happens every day so that the people at the gym know why they're wiping down their machines. The person who's reticent to have that conversation knows that you're a safe person to talk to about that. So having you all on here has been just amazing, and I can't tell you how much I appreciate it, and I know that our listeners really will value the information. So thank you.
Thank you.